Final video of the series is going to discuss endocarditis, which is an infection of the endocardium. This is the inner lining of the heart. And specifically, endocarditis is going to affect the heart valves. Most commonly, it's due to bacteria or bacterial endocarditis. And sometimes can be from a fungal infection or even a non-infectious cause. However, bacterial endocarditis is by far the most common. Untreated, it could lead to the destruction of the valves. It can also lead to embolization, heart failure, and even death. So remembering the pathophysiology of infective endocarditis, there has to be something that led to endothelial damage. Usually it's trauma or turbulence from valvular disease. Sometimes foreign materials can also introduce this infection in the prosthetic valves, pacemakers, because it will lead to small platelet fibrin thrombi. Also, vegetation growth and destruction can cause endocarditis, leads to valve dysfunction, systemic emboli, also local complications like abscesses forming on the valve areas. Microbial seeding is another way that endocarditis can occur. And this is due to circulating bacteria from a transit bacteremia adhering to a thrombi, forming infective vegetations on the heart. So what are the risk factors? They are structural heart diseases like rheumatic heart disease, maybe you have a bicuspid valve disorder, mitral valve prolapse or regurgitation. Prosthetic heart valves and devices like we talked about earlier, like pacemakers and prosthetic valves. If you have a congenital heart disease, like an unrepaired cyanotic heart defect from childhood, or surgically repaired defects using some type of prosthetic material, this puts you at more risk for endocarditis. Other things that some patients may not be aware of, but IV drug use increases your risk for endocarditis because injecting drugs can induce bacteria, especially for this. And then dental procedures, surgical procedures, or even catheter-related infections can introduce, again, this transient bacteremia causing microbial seeding. HIV, diabetes, and malignancy are other ways to be introduced to bacteria causing endocarditis. So the next part of my question here has to do with prophylaxis. Now, why would we give prophylaxis for endocarditis in the first place? Well, any patient that we have identified as being a high-risk patient for transient bacteremia, we might want to provide antibiotic prophylaxis. So if we know a patient is at high risk and they're going to go in for a specific procedure, maybe it's dental work, then we might want to start them on antibiotic prophylaxis. Now, who's at risk? Who needs prophylaxis? If someone has a prosthetic heart valve, they've had a history of previous infective endocarditis, or congenital heart disease. Any recent transplant patient or anyone with unrepaired cyanotic defect, like tetralogy of Fallot, although it would be very uncommon to be an adult and have unrepaired cyanotic defects. But patients that are pediatric, and the pediatric population can also get infective endocarditis as well. So the dental procedures that we were talking about that put patients at a higher risk profile. Extractions, so tooth extractions, root canals, any type of manipulation of the gingiva, or even cleaning with expected bleeding, this could put a person at higher risk. If a patient is having some type of respiratory procedure, like a bronchoscopy or a tonsillectomy, this can also put them at risk. Even skin biopsies or surgical debridements of infected tissue puts them at higher risk for circulating bacteria. Now we need to think about, well, what is the antibiotic regimen for endocarditis prophylaxis? Now, for most standard patients, amoxicillin given an hour before the procedure, usually about 2 grams for an adult patient, is standard protocol. But if they have a penicillin allergy, we can also move into different classifications of antibiotics, like clindamycin, azithromycin, and even acetylycin, if there's no anaphylaxis history, of course. Please read a little bit more about infective endocarditis, and perhaps it would be helpful too to look for some images in your textbook to help really solidify this learning.